mass shooting in California comes just days after a deadly shooting at a Planned Parenthood clinic in Colorado. 3 people were killed there.
So the question is, what impact might it have on Planned Parenthood here and its patients? Ashley Coffield is with the organization. Welcome, Ashley.
Good morning.
I know this shakes you up. Actually, all of this shakes everyone up because it seems like at any moment, who knows what could happen. What precautions have you taken, if any, here so that your patients have a feeling of comfort?
Well, we're really sad about what happened in Colorado. We're heartbroken, but we're also so grateful to law enforcement and to the Planned Parenthood staff in Colorado Springs who were so brave and courageous and saved many lives. And we feel like we have very strong security measures in place at Planned Parenthood affiliates across the country. We have more than 700 health centers nationwide. And at our health center here in Memphis, we think we have very strong security measures in place.
Did you do anything to strengthen it after, or did you already feel like what you had was adequate?
We reviewed our security protocols over the weekend. Our security falls into 3 categories. One is staff training, and we reviewed that and went over protocols again with staff. The other is relationship with law enforcement, and we've been working with them this week. And thirdly is equipment in our facilities, and we feel like we have good equipment at our facility here in Memphis. But we don't feel like patients should have to walk through an armed fortress to get contraception and well woman care and cancer screenings and abortion.
Have you received any calls? Are there any concerns out there locally? What have you had to deal with?
You know, in fact, what we've been dealing with locally is an outpouring of support for Planned Parenthood. We've gotten calls and emails and people stopping by to say, we support you, we're so glad you're here. We've been in Memphis for 75 years, and we're not going to be bullied into not providing the care that people in our community need.
Planned Parenthood has been sort of in the crosshairs this year with the videos that have been leaked. Congress, you know, congressional leaders are saying we need to defund some of them. You know, they're certainly looking at that because of the issue of selling fetal tissue. Has that ever been done here? Has that ever been a part of Planned Parenthood of Greater Memphis?
In Memphis, we have never offered our patients the opportunity to donate fetal tissue for medical research. And I want to be clear that those videos were manipulated and they're lies. There have been investigations at the federal level and in many states, and they have found no wrongdoing because there is none.
Have you had people call when they were released? Because, you know, you could say that all day long, and people who believe what they believe are still going to believe it. Do you have concerns expressed by people here? Have there been an increase in protesters, anything like that?
We did see an uptick in protests, some very large protests at our health center in July, shortly after the videos came out and the smear campaign started. Those have settled down now, but I think that the hateful rhetoric that we're hearing from politicians in our state and at the national level, I think those words matter. And I think it has an impact on people who are unstable and can incite violence.
So Ashley, how do you deal with the issue of, or the possibility of lack of funding and trying to convince lawmakers out there that the funding is still needed?
I don't think we need one less provider in Shelby County that sees low-income patients. 10 care patients are an important part of our patient population. We gladly accept Medicaid reimbursement for cancer screenings and well woman care and contraception because women in our community need those services and they need a place to go. We provide care for walk-ins, we offer same-day appointments, and we're the provider of choice for thousands and thousands of women in Shelby County.
And without it, what would happen without that funding?
Well, you know, people would not have the option of coming to Planned Parenthood who use Medicaid as their health insurance, and I don't think that's right. I think they should be able to go to the provider that they choose.
Are you optimistic right now that the funding will continue?
Well, many states that have canceled their Medicaid contracts with Planned Parenthood, it's been challenged in court, and in state after state, and most recently in Alabama, federal judges have said no, patients on Medicaid may go to the provider of their choice, and that includes Planned Parenthood.
Okay.
Thank you, Ashley.
Thank you very much for your perspective.
We'll link to the website. There is also a vigil for those who lost their lives and were injured in Colorado, and there's the information on the screen.
Thank you for your time.
Good to see you.
We do appreciate it.